Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, welcome. This is Dr. Jacobs. In this video, I'm gonna go over the 3 common side effects for total knee replacement surgery. And majority of the surgeons do not communicate with their patient regarding those 3 common side effects. And actually, if you're gonna have total knee surgery, you will have to have those 3 common side effects. It's part of the surgery. Also, in this video, I'm gonna go over, based on a study, the success rate of knee surgery and also why you might not need total knee replacement surgery based on a study. This is a quantitative study that looked at several healthcare settings that performing total knee replacement, and what they have found that several of those different settings identified that non-surgical treatment underused, which mean that natural or non-invasive treatment for knee has not been offered to their patient. And actually, most of the settings, they push and overuse the recommendation for total knee replacement. That's a red flag actually, and that's concerning because total knee replacement, it takes at least 3 months of rehab. It's very aggressive surgery on the body, and in some situation it could be avoided, and also the recommendation for it is not accurate. So when we look at the same study, they found that in this quantitative study has described that how believing that one has bone on bone. So when your surgeon says you have bone on bone and the only option is surgery, this is actually misconceptions. So bone on bone changes in the knee cause wear and tear that will only get worse over time. This is misconception based on the study. Can motivate patient to minimize loading through the knee. So when you have bone on bone, the common recommendation is don't put weight on your legs, stay off of your legs, don't be active. That's misconception based on the study. And the findings suggested that there may be need to correct misconception among clinicians that are being passed to their patients. So a lot of the time when I hear it from a patient, oh, I have bone on bone, my surgeon said the only option is total knee replacement. And actually based on this quantitative study, that is not an accurate way to treat knee surgery, because a lot of those settings, they actually underutilizing the natural approach to relieve knee pain and actually pushing to expensive, aggressive treatment like total knee replacement. Some patients require the treatment as total knee replacement, but it's overused, overutilized based on the studies. And if you have bone on bone, that's not indicative for the surgery, because if you have bone on bone, does not mean your pain is coming from the knee joint. Your pain could be coming from your muscle, from your tendon, from your ligament, from other tissue around your knee, soft tissue. And even you have the total knee replacement, if your issue in the soft tissue, that's not gonna resolve it. So another study here, they looked at the success rate of total knee replacement. The failure rate is 22%, as with no significant difference. Failure rate, that's from the American Academy of the Orthopedic Surgeons. Okay, so what are the symptoms and the common side effect that majority of the doctors do not communicate with their patient? To answer this question, we need to look at what's look like before the surgery and after the surgery, so it will make a lot of sense. You're gonna have the side effect no matter what. even if you have the best surgeon, you have to have those side effects. That's part of the total knee surgery, and unfortunately is not communicated to the patient. And when we treat them in physical therapy, patients surprised why I have this issue. I'm like, that should be communicated before the surgery, so you have proper realistic expectation after the surgery. So that's what they usually recommend for most patients. If you have bone on bone or degenerative joint here, that's recommending the surgery. So what they do is actually they shave this part here and shave the part of your bone in here to make it flat, so they can put the hardware, which is the femoral component here, and also they put a plastic spacer here and metal underneath it, so it will kind of like take the shock as a shock absorption. So this is very aggressive surgery, and as you see it here, it's a big cut. There's a lot of work that the surgeon does to replace the joint. So I recommend utilize non-invasive approaches first before jumping to the conclusion I need total knee based on the studies, because total knee is overprescribed for patients. So when we look at this image, you will see that you start to have like a lot of swelling here, a lot of scarring here, and those actually the side effect, that complication that you will have after the surgery and has not been communicated. So there were three ones that all the total knee replacement surgery that you will experience those side effects. Of course you will experience pain. It's gonna be painful procedures. It's gonna be painful after the surgery to recover. There is a lot of pain involved after the surgery. The other side effect that's commonly happen for all the patients is scarring. Your body has to build a scar. If your body does not build a scar, your wound will not heal. It will not close the wound. You want the wound to close. And the only way your body closes the wound, you have to scar. The problem is you're going to have a lot of scarring. And that's one of the main complications after the surgery, that a lot of patients do not have a good success rate if they work with therapists that do not know how to break the scar tissue or do not know how to decrease the inflammation. If the therapist focus only on exercises and stretching, the outcome probably will be failing because they did not break the scar tissue, they did not really decrease the inflammation. So scarring, inflammation are extremely common side effects and for the total knee, and of course pain. The less side effect wound infection, and I had patients that I know that if they have infection after the total knee and the antibiotic does not work for those patients, unfortunately they have to go again to replace the knee. And this is a terrible process that the surgeon has to remove the joint, the new hardware, and put a spacer so the patient will not be able to walk. They have to put him on antibiotic, and then when the infection goes down after 3 to 6 months, they have to put the hardware. But that's mean for 3 to 6 months with that spacer, you should not put your weight on your leg, and basically you will be bed bound until you get the second surgery from the complication of the infection that your body not able to fight it. So the other side effects, nerve damage, new hardware problem. Yes, it could happen. The problem with the new hardware could be the hardware is bigger size or smaller size than your knee. That could be a problem, or malfunction of the hardware. You have to go through the same surgery again if a hardware issue exists in your condition. Blood vessel damage or DVT, blood clotting, but the most common ones is pain, excessive scar tissue inflammation. And I will leave a link underneath this video for the 3 natural steps that you can take at home to prevent or stop knee pain and avoid surgery. We'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to asterinstitute.com.